I'd like to start at the very beginning of how osteopenia and osteoporosis are even diagnosed in the first place, because that's where we go wrong, is right out the start. We are wrong because we are using 40-year-old technology that could be wrong up to 70% of the time. I am a very big player in raising awareness to the fact that we are doing things all wrong when it comes to bone health. We are scaring the heck out of women and actually contributing to more bone loss is what's happening. So when you get a diagnosis of osteoporosis or osteopenia, especially osteoporosis, and if you get a diagnosis that says that you have severe osteoporosis, you are scared still. Scared still means you move less. And when you move less, you lose more. So actually, the way that we're diagnosing and the terminology we're using is scaring women into making their bones even weaker and at a greater risk of fracture. On top of that, we have poor training. We're doing it all wrong when it comes to the way we're training the physicians to find the disease because we're using the wrong technology, the DEXA scan. And then the training is to find the disease, and here's the pill for the disease. So we're actually focusing on the what. The what is the disease, right? We find osteopenia or osteoporosis from a machine. So that's the what. The what is you have osteoporosis. You have osteopenia. It's not the why, it's the what. And we are managing the what with a pill. Here's the pill for the what. But it doesn't actually do anything for the why. Why are you losing bone in the first place? And so we use these medications that we have a short term. We can either use them for 2 years, or some of them can be used up to maybe 5 years. And then we have to go to the next one and the next one and the next one. And we are not addressing the why of your bone loss. So that's why I say we're doing it all wrong. We're looking at the what and not the why. And if you don't get to the root causes and the why, you can't stop it from happening. And if you don't stop it from happening, then you're chasing the symptoms. You're managing the disease for the rest of your life. And that is not okay. It's disempowering, and it takes away the control of women of their own body and their own bones. So we use this DEXA scan to look for this disease. And then the physicians themselves, because the only tool in the toolbox are pills, and then they're also recommending supplements, vitamin D and or calcium. And so the only tool in the toolbox is a pill. And if you say, I don't want to take the pill, what are they supposed to do? And because we respect our physicians and because they need and want that respect, some more than others, we can actually create a combative relationship. And this is what I hear over and over from women. I don't want to fight with my doctor. I'm worried about what to say to my doctor when I go to see my doctor. So where and why do we not have control over our own body and bones? When did this happen? Why do we feel scared to go speak to our doctor and say, you know what? I don't want to take a medication. Why are we scared? Well, we're scared because that room and that relationship, there's one recommendation that exists for a doctor, a pill. There is not the lifestyle approach, which is what we need to do when we want to uncover root causes and stop it and nip it in the bud. That's the lifestyle piece, but that's not the training for the physicians. The training is find the disease and here's the pill. Because big pharma and big insurance are what runs medical schools. And the way we've trained our doctors in these last, I don't know how many years, has been controlled by big pharma and big insurance, which means pills are the recommendation. We are managing diseases, not promoting wellness. I'm so frustrated when I get on a discovery call with a woman that is scared still. And I want to raise awareness so that if you find yourself in a scared still position, that you realize that you're in control of your body and your bones, not your doctor. Of course, respect your doctor. I respect doctors. I interview so many physicians on my podcast. I prefer to interview functional medicine physicians. That's my preferred person to interview. And the reason why is because a functional medicine doctor is looking for your why. and is not trying to manage your osteoporosis. They're trying to find, why do you have accelerated bone disease? And then let's throw in another little thing here. The DEXA scan is comparing you to a 30-year-old. So I want to ask you, do you look the same as you did at 30? Is your body and your skin, the elasticity in your skin, do you have any wrinkles? Do you have any gray hair? Have you changed externally from age 30? Because if you have, do you think there's been an internal change? Yes. Why would my bones be as strong as they were 20, 25 years ago? If I have wrinkles and I have gray hair, then I must have some things happening to my skeleton. So just reframing how we even approach bone health is what I hope to achieve in my mission and in my life's work, is to raise awareness to what the heck are we doing? And it's all wrong, and let's change it. Because the diagnosis of osteoporosis and osteopenia is not a physical diagnosis. Yes, we are diagnosing physical things like bones. The diagnosis of osteoporosis or osteopenia goes right to how you feel about yourself. Do you feel strong? Do you feel fragile? Do you feel breakable? And if the word severe are thrown around, if the numbers that come up on the DEXA scan are high, -3 point something, -4 point something, that diagnosis is a mental, emotional diagnosis, and it's going to determine what happens to you from that moment. And then if you're in a combative relationship at that moment, which can happen, I have women telling me their doctors say, fine, you don't want to take the pill, then you're going to break your hip within the next year. I mean, they really do say that. Or be careful on your way out to your car, you might slip and break your bones. Now, this is legitimate. I'm not pulling this out of thin air. I am relaying to you what I hear when I have discovery calls or when I work with women. This is what I hear. So this is what is being shared and said. So the relationship can be combative. The feelings can be terrible, not good, sad, worried, scared, and all of that. Well, that's wrong. That is wrong. And that is what we need to change. So I have other podcast interviews that I've done with orthopedic surgeons that speak about my preferred methodology of testing your bones, which is called the REMS, which is an ultrasound. And I was speaking with someone kind of explaining this. If you go to a cave and you yell in a cave, or that this is what people do, and they say, hello, 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 and how many you hear, like how what's in that cave. And if you're in a room where there's not a lot of furniture, there's a lot of sounds that are picked up. Well, when there's things in the cave or things in a room, then the sound gets absorbed. So the ultrasound technology can actually tell how much stuff is in your bones, because the more stuff, known as bone quality or bone strength, the more stuff that's in your bones relates to stronger fracture-resistant bones. And that's what we want to focus on, is bone strength and bone quality, not bone density. Dr. Andy Bush, who is an orthopedic surgeon that I interview a few times on my podcast, he gives this analogy of a pencil is not very dense, a piece of chalk is very dense. If you drop both of those, the chalk will break, the pencil will not. He says that any structural engineer will tell you that you do not build a building according to density. You do it according to strength. So why are we looking at density of our bones for fracture? We should be looking at strength and quality. And strength and quality of your bones happens inside. It happens with the foods we eat. The foods you eat become the information for every cell. So your bones are what you're eating. Now, I would go a little farther and tell you that actually you have to get from your mouth to your bones. And what's in between your mouth and your bones? Your gut. So you need to have a healthy gut in order to get the food you're eating for your bones to get there. So there is the lifestyle aspect to this. And so that is not, doctors get, I think, a few hours of nutrition training. So they're not going to be able to give you the nutrition training. They're also not trained in exercise, and we have to move and push and pull in our bones every day. They're not going to give you that information because they're not trained in that information. So if you want to be in control and in charge of your bone health, you need the lifestyle that every day you focus on strong, fracture-resistant bones. And when you do that, you know what happens? It's really amazing. When you take control and take charge of your bone health using the lifestyle, making sure your gut is healthy, doing the right exercise, managing stress, optimizing sleep, optimizing digestion, you actually feel stronger. You move more. When you move more, you build more. And even if you haven't had another DEXA yet or another REMS yet, that feeling of strength is what gets you every day to keep moving forward and creating even more strength and more density. So I am so frustrated with the Western approach to bone health. It's outdated. It's wrong. It's disempowering to females. And I say females because it's mostly women that have osteopenia and osteoporosis. So we're going to change that. I'm going to change that. You're going to change that. You're going to take control and be in charge of your body and your bones. We will respect our doctors and we'll go to the ones that are actually functionally minded, looking for the why and helping you do all you can to promote wellness in your body and in your bones. Because ladies, I am on a mission to change the global perspective of bone health. From a degenerative, progressive disease that happens with aging to the awareness and the understanding that it is a lifestyle, metabolic, inflammatory-based disease. And when you change your lifestyle, you change the disease and you move away from the disease. And you can do it. I did it for myself. I've changed my bone health. I moved my numbers. I've seen this happen hundreds of times. And listen to the physicians that I interview that tell you they see it. I ask almost all of them, is bone loss reversible? Is osteoporosis reversible? And the answer is yes. Thanks for joining me on Stronger Bones Lifestyle. Are you ready to take charge of your future? For show notes, resources, and information on my programs, please visit DebbieRobinson.com. If today's episode empowered you, be sure to subscribe, leave a review, and share it with someone who needs it. Together, we're building stronger bones and stronger lives. Take care, and I'll see you in the next episode.